Our interview is with Dr. William Morris, President and CEO of the Academy of Oriental Medicine in Austin, Texas. Dr. Morris holds several degrees in Oriental Medicine, including a master's and a doctorate degree. He also has a Master's of Medical Science from the University of California. On the clinical side, he is a specialist in Chinese medicine dermatology and pulse diagnosis, having studied under direct family lineages in China for a combined 12 years. Dr. Morris has spearheaded the movement in the United States to integrate Chinese medicine into the American healthcare system. Welcome to the show, Dr. Morris.
Thank you, Frank. It's good to be here.
Can you talk to us about what a first professional degree in Chinese medicine is?
A first professional degree, whatever the title, bachelor's, master's, or doctorate, is a degree that's required to enter a particular profession. And usually the receipt of the first professional degree is required for licensure in a given state. And so the only first professional degree that's currently available for acupuncture and oriental medicine is the master's degree. And so what's currently available is also a postgraduate clinical specialty, which is a doctorate of acupuncture and oriental medicine. And that's about a 2-year course of study that takes place after the entry degree. So the field has basically those two ways of pursuing study in the medicine. That is the first professional degree, which is the master degree, but then also the doctorate of acupuncture and oriental medicine.
Dr. Morris, we're hearing a lot about evidence-based medicine these days. Can you explain what the term evidence-based medicine means and what it means to the general public?
Evidence-based medicine is a means by which medicine establishes best practices. And those best practices are determined primarily by placebo randomized controlled trials, placebo-based randomized controlled trials. And that's at the top of what you might call a knowledge pyramid. At the bottom are qualitative research methods such as medical anthropology, case-based studies or case series types of studies. And this business of a body of evidence used to make policy decisions is important. But I think that we need to move towards some richer data collection where we might combine methods such as qualitative research and quantitative research to get richer data fields than what might be available when we have numerical equivalents.
Dr. Morris, some of the people who go to their acupuncturist, herbalist, are familiar with some of the terminology used in Chinese medicine. For instance, yang deficiency, spleen qi deficiency, liver qi stagnation, and so forth. How do you see this changing with the integration of Chinese and Western medicine?
Well, I think the conversation centers around what is patient-centered care versus physician-centered care. Chinese medical jargon is an indisciplined, professional, technical form of language that's important for the practice and for understanding the process of assessment and diagnosis and treatment planning. However, this is not important for the physician out there or the insurance agency and for most patients. And under those circumstances, the explanations are conducted better on the basis of the terms that those people understand. So for a physician, we might say that liver qi stagnation is really neurally mediated type of a functional disorder. Would probably fit their language patterning, whereas for the patient, we might just say, well, this is a stress-induced phenomenon, and it's affecting the function of your organ.
And finally, do you see acupuncture being performed by licensed acupuncturists in hospitals across the United States anytime soon?
We see hospitalist practice of acupuncture occurring right now. For instance, Cedars-Sinai Hospital in Los Angeles has acupuncturists providing inpatient services at the hospital. This is also going on at Good Samaritan Also, UC San Francisco has hospitalist services using acupuncturists. And those types of evolutions in the culture of care require larger support from the social systems in which the hospitals operate, because they have what are called fairness policies, whereby all patients must be able to get care given a reasonable set of circumstances. And so what becomes important are things like H.R. 646 and the Medicare coverage, or some type of care that's supported by the social system at large. And this is an important feature of what makes it possible for hospitals to provide these types of services.